Hi, I'm Dr. Marty Rossman, and I've been a physician for over 45 years. I've also been an acupuncturist for most of that time. I was lucky to get introduced to acupuncture way back in 1971 when the American Medical Association first sent a blue ribbon delegation to China and brought back a videotape that I saw in my medical staff meeting. In that videotape, we saw a man having part of his lung being removed because he had lung cancer. And while the surgeon was cutting through his ribs with a big rib cutter that looked like a bolt cutter and lifting out a section of his lung, the man behind a screen was talking to his nurses who were feeding him sips of tea and sections of mandarin oranges. And the top of my head just came off. I thought, what is that? Because the only anesthesia he had were 4 acupuncture needles, 1 in each arm and 1 in each leg, that were being twirled while all this surgery was going on. At the end of the operation, they dressed his wounds. They wrapped him up in dressings. He sat up on the table, put one arm around each of the surgeons, and walked out of the operating room to polite applause from everybody who was there. And the leader of this delegation of American physicians, who were all experienced, highly placed, very credible people who had spent 40 or 50 years in medicine, was a Dr. Samuel Rosen, one of my 2 medical heroes, professor of ENT at Columbia. And he looked into the camera and he said, "We've seen 100 of these operations. We believe there's something real going on and it deserves serious investigation." I found the first major research project on acupuncture treating people with intractable, untreatable chronic pain, rejects from the Mayo Clinic, the Cleveland Clinic, University of Michigan, people that had had heavy drug addictions, spinal surgeries, nerve blocks, had had everything. If you could have treated any one of these people, you could have written it up for a medical journal. But after 3 years or so, when they reported their results, they were able to help about 45% of these people, which is truly astounding. And that's when I saw acupuncture was a real phenomenon. I began to study it and I incorporated it into my medical practice. The acupuncture led me into contact with a lot of the leaders in the early holistic medicine movement in the early 70s who were exploring nutrition, acupuncture and Chinese medicine, and especially mind-body medicine. And it rekindled my longtime interest in how do the mind and body work together in life and in medicine. And we can include the spirit in that too. And what makes them not work together? And how much can we do with our mind to influence our health? So I incorporate those every day into my medical practice, treating a very wide range of people with a very wide range of illnesses and diseases and distress. And I want to talk to you today about some of these non-pharmacologic approaches to pain management, focusing especially on 2 things, guided imagery and acupuncture. Pain is not just a simple experience of having a negative feeling in your body. There's also another layer, which is the suffering component, the emotional component, along with the pain. So the way we talk about that in pain medicine is that there is something called nociception. Nociception, which is a pain experience, a pain feeling, comes from tissue damage. And in acute pain, when we sprain an ankle or break a bone or have some other kind of injury, there's tissue damage. The body generates pain. Let the brain know, I've been injured, I need some kind of special attention. And it's a pain that works for us in a way. Hopefully you pay it the right kind of attention and the pain goes away. In chronic pain, one of the mysteries is that even though the tissues heal up, some people remain in pain and develop a chronic pain problem. And while we don't know the complete answer to this, some of that, we believe, is because there's another component of pain besides the tissue damage, which is the emotional response in the brain and what people believe about the pain. So for instance, if you fall down and break a leg and you have a lot of pain and you feel like, bad luck, I slipped on a rug and I'll heal up and I'll get better, that's one situation. If your response to it is, what an idiot I am, and I'm always doing stupid things, and I'm always hurting myself, and I deserve to have this pain, you might end up with a different, first of all, you'll have a different acute pain experience, but you might be a little more prone to ending up with chronic pain. If your belief system is, this always happens to me, I'm a target for things like this. If you're like that guy in the Peanuts cartoon with the rain cloud over his head, it's always raining on him and nobody else. If you feel like God has it in for me, if you feel like I have bad karma, I must have been bad in another life, or you have that kind of belief system, either consciously or unconsciously, that you kind of deserve this, that you've been picked on, that there's nothing you can do about it, your response to the pain may set you up for this pain starting to kind of take root somewhere in your brain and becoming chronic. And something that we've learned about pain is that people with chronic pain, because we can look at your brain now when you're having pain, and if we look at the brain of somebody who's injured themselves and has acute pain, the activity in the brain will be in the area of the brain that's connected with the body part. In other words, if you sprain your ankle, we look at your brain, we'll see that there's a very active place in the pain circuits that are connected to your ankle, okay? Now, if you go on for some reason and don't heal up properly and you develop a chronic pain in your ankle, that even though your ankle is back solid and sound and nobody can find a problem with it, but you still have a pain in the ankle, say a year later or 2 years later, which sometimes happens, if we look at your brain then, we find out that the activity is in a completely different area of your brain, and it's actually in an area of your brain that processes emotion and memories. So the pain itself has found a home in some part of your brain that's tied up in memory and emotion, mental emotional kind of response. That's much harder to treat, but it's not impossible. So it's interesting to look at drawings that people make of pain. Some of these drawings have been lent to me by my colleague, Dr. David Bresler, who was the head of a very innovative pain treatment unit at UCLA that involved the anesthesia department, the psychology department. He introduced acupuncture to UCLA back in the early 70s, was really one of the early leaders of the holistic medicine movement. And he would ask patients to draw pictures of their pain and then describe to him what was going on. Here's a picture of a man. You can see he's in a clamp that's folding him together. He's got a knife in his back. He's got another knife up in his shoulder. And when Dr. Bresler would ask him to tell the story of the pain, and he would ask him, tell me about that knife in the back. And of course, the man had a story about a terrible betrayal by a business partner. So again, it's this folding together of life stresses, emotional events, betrayals, and some weaving together of beliefs and emotions and injury that can sometimes make the setting for chronic pain. Fortunately, it sometimes gives us a way to work with it that can help people work out of that pain. So there's the typical pain approaches are medications, surgery, anesthesia, physical therapy, chiropractic, massage therapy, exercises, stretching, body-mind approaches like Tai Chi and yoga and Qigong, electrostimulation, acupuncture, nutrition. All of these things can be helpful for a person that's got a difficult or chronic pain problem. So one of the major modalities that we've learned to use is guided imagery. And guided imagery is basically a type of daydreaming, really, but it's daydreaming with a purpose. We use it to help people relax and reduce stress, to interrupt stress responses, to relaxing the muscles, to improving blood flow, to washing away waste products so that waste products of inflammation and metabolism don't accumulate so much in a certain area. We use guided imagery to help people listen to their bodies. There's a receptive aspect of guided imagery where we ask people to focus in a relaxed state on their body and see if their body could talk to them, what might it say to them? If their painful knee, could express itself? What might it be asking for? What might it be trying to do for the person? What does it need in order to heal better? These kinds of mental conversations that we do, typically with imagery. So we might ask for an image for that pain. And when you get an image that represents the pain, you have an imaginary conversation with it. What are you doing here? What do you want from me? What do you need from me? Is there something you're trying to do for me? Is there some signal you're trying to send that I don't quite get? And we engage in this internal imaginary conversation. It sounds kind of weird, actually, when you think about it in a shallow sense. But when you work with it, you find out that it can be a very deep and very effective way to relieve pain. Some years ago, I did a demonstration in one of our professional trainings for guided imagery. We have a postgraduate institute that's been going for 30 years now that teaches health professionals to work with this process called interactive guided imagery. And a volunteer came up, and she had had chronic pain in both forearms for 3 or 4 years. And she'd been through every kind of medical treatment, every kind of physical therapy, every kind of modality. She was on pain medications. They didn't really help very much, plus she had a lot of side effects from them. So she was in a situation where she had chronic pain. So I led her through a little relaxation exercise, invited her to imagine herself at a peaceful, calm, safe place. I don't remember exactly what that was right now, but when she was relaxed in that place, I asked her to focus directly on the pain. And the instructions are just let an image come to your mind that can represent that pain and that we can learn something from. And the image that came to mind were these solid black metal bars. She said, I feel like I have solid black metal bars in my arms. And we explored the image in a way that we do. And I asked her to tell me to just tell me what else she notices about these bars. And she said they're very rigid, they're cold, they're unbending, they're inflexible. And as she described those qualities, I asked her to go a little deeper, and I said, how do you feel towards them? She says, I'm really upset by them. They hurt me all the time. I don't know what to do with them. And as we went a little deeper into this, I asked her at one point, does this remind you of anything? Cold, inflexible, unbending, frustrating, not knowing what to do with it. And within a few seconds, she almost gasped. And she said, you know, she said, when I developed this pain, I was caretaking for my grandfather, who was at the end of his life. I took care of him for a couple of years while he was toward the end of his life and eventually dying. And he was exactly like that. She said, we came to have a loving relationship in the end, but those qualities describe him to a T. He was cold, he was rigid, he was inflexible, he was unbending. Much of the time I didn't know what to do with him. That's when my pain started. And when she realized that, she broke down, she started to cry. After a little bit of crying, I asked her to focus back on the bars and had her imaginally ask the bars if there's anything that she could do for them, and they softened up immediately. Her grandfather came to mind. He'd been dead for several years now. And when the image of her grandfather came to mind, I said, just look at the image of how he looks now. How does he look? And she said, you know, he looks different than he looked. He looks much more relaxed. He looks much friendlier. He looks much more approachable and accessible. He's actually looking at me like he loves me. And I had her continue this imaginary conversation. And the image of her grandfather, so I'm not saying it was her grandfather, it was the image of her grandfather. May have just been a circuit in her brain, or it may have something to do with her grandfather. I don't really know. And as a doctor, I don't really care, really. The image of her grandfather thanked her for all the care that she gave him, thanked her for her patience, thanked her for her warmth, talked to her about why he was the way he was, and shared some things with her that they never talked about. And at the end of this imaginary conversation, they had a warm hug. She continued to cry. And at the end of this session, which was about 20 to 25 minutes, she already had some relief in her arms. She said, my arms feel better. I can actually feel them feeling better. Her pain continued to diminish, and within about a week to a week and a half, her pain went away. It doesn't always happen that cleanly and that beautifully, but it's a great example of how life situations, especially that involve emotions, can kind of precipitate and crystallize in the body. Now, I'm not saying that all pain is like that. I think there's other causes of chronic pain too, but a good deal of it has an emotional meaning and an emotional overlay. And when you deal with that, and guided imagery can be the quickest, most efficient way to deal with that, especially if you have a trained and experienced therapist to work with, or to use a program that'll guide you through the various steps. It's amazing how much of that can unwind, unravel, start to make sense, and people find that they start getting actual pain relief. So guided imagery, again, is just the use of the mind to improve your health and well-being. Sometimes the default position for imagery is that we worry, or one of my favorite cartoons says that there's a little character who says, the figments of my imagination are out to get me. If you don't have good skills with your imagination can actually come up with things to worry about and stress you that you wouldn't have come up with without an imagination. And a runaway imagination can be a great source of stress and actually amplify and make things like pain worse. So we need to learn how to work with the imagination on purpose to relax the body and relieve pain rather than letting it work unconsciously to create pain. Now, imagery is simply thinking with sensory qualities. So as the example I gave you, to focus on the pain, let an image come to mind, something you can imagine seeing or feeling or hearing or sometimes even tasting. My patient could feel the coldness, the rigidity, the inflexibility of the iron rods. So there's a sensory image. It's kind of more tangible than an abstract thought. And the imagery may reflect the external world, but it always reflects your internal world. And imagery is really kind of like the Rosetta Stone of the mind, body, spirit. It can represent not only the physical symptom, but also the way it's connected to the rest of your life, as that example, I think, shows you very nicely. It's the language of the emotions. It's the language of the unconscious. It's very rich with information that we don't often get. The physiologic effects of imagery are tremendous. It can affect heart rate, blood pressure, respiratory rate, blood clotting, clearance of waste products in the body, digestion, sexual arousal and function, muscle relaxation, endorphin secretion. So the effects of imagery, both negative if you let it work on you, and positive if you learn how to use it on purpose to create a relaxation response and to create the opposite of a stress response, are really very powerful. And we have a lot of imagery resources that are produced by me and other experts in the field at thehealingmind.org. So the second thing I want to talk to you about is acupuncture, which I mentioned in my introduction, a technique of using fine needles or an herb that you heat, or acupressure, or now we use low-intensity lasers that don't hurt, don't burn, the light goes through the skin, but we don't even have to use needles. We can use it on infants and children, people that have needle phobias. A lot of people in their minds are afraid of acupuncture needles, but in general, actually it turns out to be a very pleasant experience. You wouldn't think that. When we use the laser acupuncture, which I use very extensively now in my practice, very low intensity, cold laser that doesn't burn and doesn't hurt, stimulates certain points under the skin, sends messages to the brain sends different messages out to the body, and it can help to balance the body, relieve pain, and stimulate the healing abilities that the body has built into itself. Now, some people have problem with acupuncture, some professionals, and they say it's not proven, even though the World Health Organization has studied the evidence and feels that acupuncture has been pretty decently proven to be helpful in something like 17 common health conditions, including chronic pain, IBS, menstrual kinds of pain and cramps, neck pain, back pain, osteoarthritis, and more. But there's a problem with acupuncture, and that is that it's very hard to study in the kind of study we like to see in medical interventions. Our gold standard is the randomized placebo-controlled double-blind trial, where neither the patient who gets the treatment or the practitioner can know whether they're getting the real treatment or the sham treatment. Well, there have been some sham treatments designed for acupuncture, but I don't think any of them really meet the standard. Pretty much, they'll use a needle that doesn't penetrate the skin. That might be close. They'll use a needle that creates a pressure sensation. The trouble with that is we already know that even if you put pressure on an acupuncture point, you can activate the acupuncture response. So even if you put pressure on it with your finger, much less a fake needle, if you put an electrical stimulus on the skin, because the acupuncture points are places of low electrical resistance, they're kind of like electrical pores on the skin. If you put an electrical stimulus on the skin anywhere, it'll pour into that point. So there really is no good placebo to compare to real acupuncture. So when they do research on acupuncture, for instance, a typical result will be, they did research on osteoarthritis of the knees at the University of Maryland. And what they'll find out is that, taking the medication, 40% of the patients will get significant relief. Then having sham acupuncture, so-called placebo acupuncture, 60% of the patients will have pain relief. That's with the fake acupuncture. And then if you do so-called real acupuncture, 70% of the patients will get relief. So skeptics they say, well, you get 60% with the placebo and only 70% with the real one, so it doesn't work. But for my money, that's not what it showed. It showed that it worked almost twice as well as the usual medication approach, and that even if you miss the point or don't stimulate it as much as it needs to be stimulated, you get 60% improvement. So I think our thinking around what the placebo effect means has to change. We have to understand it better. If we look at the brain with functional MRI when people are having acupuncture, is interesting because it lights up the pain relief channels. It does stimulate the brain to secrete its own pain-relieving neurochemicals like endorphins. And it uses the same pathway that the placebo effect uses. So it's long been known that when you give people placebo pain medications, about 55% will get as good relief from the placebo as from the medication. And interestingly enough, if you give someone a placebo versus aspirin, people will get 55% as much relief from the fake aspirin as the real aspirin. That's the mind-body effect, right? But if you compare a placebo to morphine, which is so many times more powerful than aspirin, the people taking the fake morphine will also get 55% of the effect of the morphine. Nobody knows how to explain that. It's like the placebo effect gets stronger as you compare it to stronger medications. Somehow the brain is able to understand really that, look, you're giving me something to create this effect, and then it creates that effect. So it has pathways that it turns on when it believes that it's getting something to relieve pain, and they relieve pain. And acupuncture turns those pathways on. So if you think of it more as a healing pathway rather than placebo, because a lot of people think of placebo and to them, placebo means it's not real, or placebo means it's phony. That is not what placebo means. What placebo effect is if I trust you, or I think you've given me something to relieve my pain, I will get pain relief. It's a very deeply unconscious process. And it, again, is responsible for somewhere between 55 to 70% of the effects of all known pain medications, including injections and including sometimes even surgery that's done to relieve pain. It's a very, very powerful effect. So as a physician, you know, researchers want to get rid of the placebo effect to see whether their drug has a real effect of its own. Because if it doesn't, then you don't need this drug that costs $2,000 a year if what it's giving you is placebo effect. And if it has side effects, which almost every drug does, we don't want to take those and we don't want to pay for those. If what's happening is that our own brain is relieving pain, we want to learn how to use the brain to do that. So as a researcher, you want to get rid of the placebo effect, but as a physician or a patient, you want as much of that healing effect as you can get. That's what we can get through guided imagery. And if all acupuncture does is turn on the placebo healing effect, that's good with me. I don't even mind telling people. You know, there's research on placebos where the researcher has given people a placebo and they say to the people, there's nothing in this pill. There is no active ingredient in here. But 1 out of 3 people who takes it gets good pain relief. Would you like to try it? And people take it, and they know that there's nothing in there, but they also know that 1 out of 3 people got good pain relief. And when they look at the data, 1 out of 3 people gets good pain relief. So we're talking about a very powerful connection here. If I say to people, I'm going to put these needles into you, it's going to turn on your body's own placebo or healing effect, that's true, that's fine, and I think it's ethical, because we want all the healing effects we can get. So because of the placebo problem with acupuncture research, you find that most of the studies are poorly designed from our point of view. They show benefit with both sham and real acupuncture. And something that the research always shows is if you have 6 treatments or more, it correlates with positive outcomes. And the Archives of Internal Medicine published a big paper about 2 years ago showing that a review of all the literature shows that acupuncture is an effective treatment for all kinds of chronic pain. It tends to affect the emotional aspect of pain more than the nociceptive portion, but that's okay, because a huge part of the amplification of pain, there's pain and then there's amplified pain. And what emotions do with pain is that they amplify it. If we turn off the amplifier, we get this much reduced signal that's much easier to live with. And the thing is that that same effect applies to opiate medications, narcotics, which are our strongest pain relievers. They don't really turn off pain. What they do is they turn off the emotional amplification pathways that amplify the pain. So acupuncture works the same way that opiates do, and probably because acupuncture stimulates the brain to release its own opiate-like molecules. They're called endorphins. You can get them with strenuous physical activity or sexual activity or things that make you very happy. Some of these endorphins, these endogenous morphine-like molecules, that's what endorphin stands for, and there's a whole family of them. Some of them, like dynorphin, is been said to be 1,000 to 2,000 times as potent as morphine. 1,000 to 2,000 times as potent as morphine. So all you need to do is get 1 drop of those out, and you're going to be feeling a lot more comfortable. There have been studies with spinal cord injury patients of 6 months duration. They compared 7 weeks of acupuncture versus control. About 50% of the subjects got significant pain relief. Diabetics with chronic painful neuropathy, 77% of them got good pain relief. 63% of the people who got acupuncture were able to discontinue pain medications, and sometimes they had to go back for booster treatments, which is okay. People with low back pain have a reduced intensity of pain that went from an average of 6 on a 10 scale, if 0 is no pain and 10 is the most, down to 2, which is pretty good. The radiating pain, like the sciatica, went from about 6.5 to a little bit over 1. And a year later, 88% of those people who had acupuncture for low back pain and sciatica were very pleased with their outcomes. Same is true with neck pain. They compared acupuncture to massage, to a sham laser, and acupuncture performed better than all of those other treatments. So on a practical level, there's a difference in how people respond to acupuncture. There are some people who have no response at all, and there are some people who respond like gangbusters. And there's a bell-shaped curve in the middle. So there's the condition, and then there's how responsive you are. And when you put those together, the equation tells you whether acupuncture will work for you. We have no way of measuring how responsive you are, except you should do at least 3 and even better 6 treatments as a trial. And if you're improving within that first 6 treatments, you'll probably go on to have a dozen or so treatments, maybe 9, maybe 15. These are getting further and further apart as you go. But that'll tell you whether you have the responsiveness inside you. It's a biological trait. It's built into your body. It's not because you don't believe in it. It's not because you're doing anything wrong or your acupuncturist is doing anything wrong. Just some people respond strongly, some not. You have to give it a fair trial, and 6 treatments is a fair trial. The reason I say that is that in the 70s down at UCLA at their Chronic Pain Institute, they took 25,000 patients with chronic intractable pain. They did 10 treatments apiece on each of them. So they did 250,000 acupuncture treatments over a 7-year period. And they found that the people who would ultimately get relief, that 80% of them would start getting relief in the first 3 treatments, and another 15% would start getting relief in the next 3 treatments. So if you didn't get relief by 6 treatments, the odds on you getting relief fell pretty close to 0. So if you decide to try acupuncture, find a good practitioner. There are national accreditation boards. There are now 40 schools of acupuncture, master's and doctorate degree level, postgraduate schools in something like 46 of the states. It's licensed in almost every state of the union now. A lot of times insurance will help you with acupuncture. You try 6 treatments. If you're improving, go on till you're as good as you can get. If you're not improving, then start to look in another direction. So there's, and also the last thing I'll say is neither guided imagery nor acupuncture need to be done without any other approach to pain. So they're perfectly compatible for the person who may also need some medication help with pain, or who may need interventions periodically and injections, or even who have had surgery. They can all work together to help you get maximum benefit from chronic pain. So thank you for listening. I'm Dr. Marty Rossman from The Healing Mind. I hope I've shared something important and interesting with you. Just realizing your mind can be one of the most important helpers in helping to reduce or relieve chronic pain. Thank you for listening.